Now, our next guest speaker is Lesley Salem, and I have had the pleasure of seeing Lesley in action at the Katzenam conference. Lesley is the Conjoint Senior Lecturer at the School of Nursing and Midwifery in Newcastle. Lesley is a descendant of the Wonnarua Nation in New South Wales. She's working in private practice as a generalist chronic disease nursing practitioner, and Lesley's nursing is dedicated to improving the health of those with chronic disease, and she has a strong dedication to the health and wellbeing of Aboriginal and Torres Strait Islander people and those with disadvantage, socioeconomic disadvantage, and her peers. Welcome, Lesley.
Anigunjanattalwa Apple of the Black Creek Nara of the Wonnarua Nation. I wish to acknowledge the ancestors and elders and the people of this land, the Gringai people of the Aurora Nation, and I want to acknowledge that we're on their land. It's our custom from where I'm from to always ask permission for all of us to be here, to travel through this country, to learn from each other and to acknowledge the people who allow us to be here. So I ask it for all of us. I was given the topic chronic disease, mental health, socioeconomic disadvantage, and where do we begin? And if I was to go and sit through, and I did, I eliminated probably half the slides because I only had like 270, and because everybody's given the stats and the information, and I don't think I have to tell anyone here that this is chicken and egg stuff. If you've got one, you've got the other, and so forth. So what I did was ask a lot of the patients that I work with. So I wanted to first of all give you a context of the work I do. Pressure from my mob, and particularly my dad, who was a Wonnarua elder, that we had a whole bunch of 20 and 30-year-olds coming on to dialysis, and I was working in end-stage disease at that stage. And they're all coming on to dialysis from where we're from, which is Karua. And they were diabetic young ones coming on to dialysis with end-stage disease. And they kept saying to me, I thought you can prevent this. I thought kidney disease is at least treatable, preventable, that you could manage it. And why don't you put your money where your mouth is? And so about 6 years ago, I walked away from a really good job in a really good place with really good super and regular pay, and made Dad happy. And so I went out and started working with not just Aboriginal communities, but anyone where there was low socioeconomic disadvantage, because a lot of Aboriginal mobs will take on those living in housing commissions who can't afford to pay doctors who don't bulk bills. So we work with a lot of groups like that. I work mostly rural, and it's beautiful country up Liverpool Plains way. I've worked in lots of different locations, but quite often rural. And the rural doctors, New South Wales rural doctors, want any nurse who's willing to go out there, any nurse practitioner, anyone who's willing to go out and give some help. I work with great people in beautiful country. I left that one in. That was a stat from 2011 that chronic disease is, 90% of the cause of death. And I don't think if I have to reiterate it. I think we've heard so many stats all along the way. And the big three, cardiovascular disease, oral health, and you wouldn't find a dentist out where we are for love nor money, and mental health. And you won't find highly qualified people giving mental health. You find nurses. And so I will get on my high horse, because I think every single person here underestimates who and what you are and what we actually do, and that we are the true healers in medicine in this country, and always have been. Once again, disparity, disadvantage equals poor outcomes. There's just no two ways around it. You look at any stats with rural areas, remote areas, any sort of disease. If you have cancer, if you have anything, you will die years earlier than anyone else. It's just simply the way. Chronic disease and social, emotional and mental health go hand in hand, and we're still doing the same old things that we've always done. Medicare items, they've shown through research and reports that the new Medicare item numbers for mental health have done diddly squat out where we are. Yes, it's helped people in cities, but not out in rural areas. So we're still basically getting what we've always gotten, because we're still doing what we've always done, giving nothing in areas that are in desperate need, and not giving it to the socially disadvantaged. So we're still getting what we've always gotten. Yes, we're making chronic disease better, and we've got great targets, and we are achieving them in some ways, but we're not getting better outcomes in our emotional health of the people that we treat. Oh, I've killed it. Might have to go back. And I think when I was thinking about, great talks, you engage with the problem, you pull the audience in, you're interested in hearing it. But basically, I couldn't come up with anything else that nobody can make a quid when you go out back. Nurses can't make a quid. We're not doing the Monash modified model of GP placement so that you get an extra, 235,000 if you go low out and you get 10 extra weeks annual leave and you anything. There is no modified Monash model for nurses to go rural and remote to get out there and slug your guts out. But guess what? When we do go out there, we stay out there. And we stay out there because we want to be there, not because anybody's chucking money at us or saying your visa to get in the country will be cut by 2 years if you go. We're there because we want to, but we need more people out there. And we need to be the focus on the biggest workforce that are out there. We need us to be out there. And we just saw fantastic research that shows that nurses make the biggest difference in keeping people out of hospital. All I'm wanting to do is all of you get out of your comfort zone, get out of the beaches and great places in Sydney, and sometimes just come occasionally out to have a look out this way. It's time for a change. That's my greatest thought. So I just want to reflect on how our patients see us. I thought that'd be the greatest tool. And I think because we're all got the same message, you're going to hear the same messages again, but you're going to hear it from their mouths and what they say about us. And I want you to help them walk in their shoes and see what it's like. I want you to think outside, not only your square, but look inside their square at what we need to do. I want you to see the burden of problems that exist out there and that you've got the skills to fix it. I want us to be proactive and not reactive. We are constantly reactive. This person has distress, let's refer. This person has distress, let's have a yak. Let's fix that person up with all the skills they need before they have to be distressed and have a reaction. Let's be proactive in what we do. And I can't say it enough. We're the mob who are out there. Every nurse in this room, every GP management plan that gets done that the doctor claims $550 and his health assessment, a nurse is done in this room. You're the ones doing the pap smears, the ear checks. You're the ones out there talking to patients and asking them how they're feeling and calling on their homes to see if they're okay. And what do you get? Who gets the fee for your review of a GP management plan or following up on anything else? There's not a Medicare acknowledgement in this country of the work and the burden of work that we take on. So don't tell me Medicare is working and it's looking at new great ways to form plans for people, because it doesn't recognise in this country that every person in this room is coming up with the plan for that patient. That's when Medicare will work, when they recognise who's doing the work. And then we'll get the equality that we deserve in the treatment and the management of the patients that we're giving them. We're taking on the complex care. So I just want to put the context of problems that are out there, the client and ours, and this is from a lot of their words, bits of paper handed back to me or I've written them because I can't write, and thoughts that I have around what could be done. We know that they're all intertwined. Chicken and egg, what comes first? You're anxious, it leads to you can't work there, you get a chronic disease, chicken and egg. It's all out there and basically it's all together, and we can't ignore the fact that it all sits there together. But do we truly understand that from their perspective? We think we budget and work hard, and you can't tell me anyone here that doesn't look at some woman with 7 kids to 4 different fathers who just bought some yarny for $70 and another packet of cigarettes for $30 and is into one of our services saying, can I have a food voucher? Don't tell me you're not biased. Don't tell me you aren't thinking, why can't you do what I do? I work. I save and go on holidays. Because I can tell you the rich think we're duds too. The rich are out there and a lot of them didn't start that way and they think, what's wrong with those people? I started like that and I'm filthy rich now. So we all have a bias and it rolls downhill. This woman was brought up in a house with God knows how many other people in a housing commission her whole damn life, poorly educated because you couldn't think of one role model in a whole family. I sat and had a conversation with a little kid the other day and he said, who's that? And I said, oh, it's a picture of my son. He said, how old is he? And I said, oh, he's finishing year 12. He goes, why? I said, because he wants to earn more money. And he goes, oh. And I said, what do you want to do when you leave school? And he goes, I don't know. And I said, well, what does your dad do? He stays at home. He goes driving with his mates. And I said, what does mum do? She's on a lot of medication and she sleeps a lot. I go, what does any of your aunties, does anybody, do any of your uncles, does anyone do anything you know? And he goes, no. And I said, what about being a teacher? And he said, could I? And he said, that'd be great. I could go on excursions forever. And I said, yes, you could. But he couldn't think of a member of his family. All behaviour is learned. All behaviour is learned. We teach our patients to think that they're useless. All behaviour is learned. And it starts with the very young. But this is the context these people are growing up on. Why is she on Yarny? Why does she smoke? If it wasn't bad for you, I think they're the best two things on the planet of the earth. They are. They decrease her anxiety. She copes with those 7 kids so she can get the income coming in. Smoking, it is a bloody marvellous stress reliever. I took up pretend smoking when I was 20 because I was the only dumb bunny at the Mater Hospital that had to stay for 4 extra 15-minute lots looking after everybody's patients while everybody went out for a smoke. So I bought a packet and I've always gone out for a smoke. I also took up being a Catholic because they also were allowed 20 minutes to Mass on a Sunday. So it is a great stress relief, a break, a breath of fresh air. If it wasn't bad for you, it is a great thing. It is mindfulness, it is therapy, but it is bad for you. But that's all they know to relieve the stress of their everyday life. And the rest falls away. Food for the kids, everything else. Someone's always picked it up. And so this is the context of their life. They're not bad people, but they've got so many other issues. And it's understanding those things. We all carry a bias, and I'm one of the worst on this planet. Boys do not clean the house like women. My son, my husband, hopeless. Yet I don't go to prejudice, so I still ask him and make him do equal housework in the house. So it's having a bias, it's recognising it, but not letting it affect anything else that rolls downhill from that. And that's one thing that a lot of people have told us we do. We bring our bias and make it prejudice at work. We look at that mother with the 7 kids on the Yarny and the smokes and we go, oh, for God's sake, I have to talk to her again. And tell me you don't do it. Tell me you haven't written her off before you've even had a conversation with her. We talk in hyperbole all the time. Oh my God, you've got diabetes. Now, if you don't stop smoking, you're going to lose those feet. You'll end up on dialysis. We talk in hyperbole the whole time. We talk in predictions so far down the track that they don't bother listening. People have become numb to our hyperbole. And yet, and I was guilty as anyone, particularly getting out there, I concentrated on numbers and the chronic disease, and I never had that hyperbole with mental health. I never looked at the effect of me telling somebody they had diabetes, that revenge! You woke them up. But do you know what I mean? We don't use hyperbole in mental health, even to ourselves, to think, oh, if I don't deal with this person who's just gone shut down and is obviously not hearing me anymore, that I'll have a real issue. But we talk in hyperbole, we trade in predictions, we threat of poor outcomes is so much that it's lost its sting and it means nothing. Everyone that lives in a poor area live in the past of who they were, their culture, their proud mob. They cling to their culture. We all cling to our culture. If it's an identity that gives you pride, something in your life that gives you pride, and they live in the now, not the future. And yet here we are with the only future they're thinking about, and we're making it the most grimmest thing on the planet of the earth for them to ever think about. It's lost its message. So you can't do it. You've got to look at the context in which people live. They live in the past and they live in the now, in many of the low socioeconomic areas. We not in mental health, as I've said, we're predictive of a timeline of consequences of a chronic condition, yet we don't predict their mental health. We don't try for ourselves, for them, to think of their mental health and put something in place. It's always been the white elephant in the room because we silo everything. I can't do that. Silo, that's somebody else's, refer. If you're lucky, they'll refer. Where we work out in most of the areas, we can't get anyone to come out. So it's a siloed and forget. Set, forget. And you don't mention it, and if you're lucky, like I said, they refer. The other white elephant is social issues. So that woman comes in with the 7 kids and she's after a food voucher and it's in your ability to write one up, you hand it off. Do you engage family services? Do you actually engage with her to see if she could get off the yarnie and save the $70? Do you engage anyone in any of the social services that could possibly help that woman get out? Do you look at TAFE for her? Do you look at anything that might earn her more money and give her a different sort of a life? No, we don't. We often set and forget. There are many, many cultural issues that we face, and I'm not just talking because you're Aboriginal. I'm talking that you're young, that you're under 25 and you're angry. And quite often you look at kids and they've got the bruises of domestic violence all over their little bodies, and you think, look at that little smart-ass tough kid there. But I'm sorry, that's just a camouflage, because the more bruises you see, the more fragile they are. They're as thin as glass. But you take them as face value that they're just a little asshole prankster who's sign written somewhere, and you've written them off. There's a lack of understanding of self-management and the risk and illness in the mobs that I deal with. Health is not valued as an asset, not at all. My mother died at 46. My nan died at 50. I'll go the same way. Yep, I've got diabetes, I've got heart disease, I've got the same thing. I'll live better now. I'm going to live better now. I'm not going to save for the future or think about my kids or in the future. You live for the now. And the problems here in the communities and the stuff I'm shoving up, that's a 40-year-old's eye. The kids in the community, it starts at 0 with the skin infections, and so many of them having to have 10 years worth of bicillin for rheumatic heart fever, and they don't turn up for it every 3 weeks because it's the most painful thing on the planet of the earth to have. But health is not valued, so the parents don't bring them in, and it's hard to get them to come in. So many people survive but do not live, and they need to live and survive. And we need to keep a focus on that. How can we get them to not just survive but to live a good life? When there are health choices, they only pick the one that they can live with, whether it's to do with money or effort or whether they think an outcome will come. And so many, and this was a comment from the emergency department because, oh, you got a mental health issue? Well, I'm sorry, but such and such house isn't answering. No, they're shut now. Oh, it's Christmas. No, Vinnies aren't helping. Salvation Army is shut. Apparently nobody gets their problem for 2 weeks over Christmas. I had a suicide, a 16-year-old, come and drop at the door on me on Christmas Eve when I was working. I couldn't get one service. Go to the hospital. And when they go to the hospital, they say, oh, they're very polite. They're so polite it's rude. They cut through rude, they cut right through it, and they make anyone who's of low socioeconomic or Aboriginal or an ethnic minority, they just make them feel like they're nothing. They're not treated well. I went to the hospital with a chest pain the other day. I look like a health worker. We all dress the same. Nobody is. We're all dressed in the same uniform. There is no distinction. There is no hierarchy of you are the great professor and you are the health worker. We all wear the same uniform. So of course they thought I was a health worker. I took up a woman in her 40s, early 40s, with chest pain, relieved by the spray at the surgery. We drove her straight in because it was quicker than the ambulance that had to come from a long way away. Got there, she was getting chest pain again and getting dizzy. For over 15 minutes, we had to fill out her details. They didn't ask me for a handover because they thought she's just a health worker. I said, she's got chest pain. She's got chest pain. Yes, we have to get the details. No blood pressure, no nothing. There is a different level of service. I'm pretty sure if somebody else walked in of a different ethnic persuasion, it would have been different. And this is not the first. This is the 10,000th time I've watched this happen. It still exists. We've got to stop how we think we see a patient. This is how we think of them all the time. We think of their illness versus all the healthcare providers versus a perception of health. This is how they see themselves. That's how she sees herself. That's how they are. So I just want you to examine our little biases that change things. We trot out logic like it's, this is one of the patients, they said, you trot it out like it's on a nice little leash. Hello, here's what you got to do. Right, there you go for it. And they said, and every time one of you says, let's have a talk, and so even that becomes difficult. They go, it just means you're going to shame me. It means you're going to harp at me. You're going to tell me bad news. You're going to tell me what I've got to do. There is no talk. There's no conversation. I was told once that we as healthcare providers are like tourists that go in. You take everything, you buy everything, you take it away. You take our culture away, you take us away. And it's true. When you go in, if you want stuff back, you give as much as yourself over. Oh, g'day, I'm Wanneroo with a good-looking mob. Who are you? I'm Camilla Roy, or I'm up from Biripi. I'm Darry Young. I'm here visiting. Oh, got relatives up here? Yep. Yeah, I got no one up here, so I stay with friends over at such and such. Bring your kids with you? Yeah, and you can almost get everything you need fill out every form. So they're homeless. They're up here visiting. You've already filled out half your form from a yak. Up here, bring your kids with you? No. Oh, yeah, I've got 3 of them with me. Oh, I've got 4. Thank God I've left them at home. You trade. It's cost you nothing to trade. It's a conversation. You trade. You don't take that information away, because guess what? When she says, I've only bought 3 up, she's thinking, are they going to tell docs? I've left one with the husband. I know he's not meant to have him at the moment, but he's good. You're taking information that'll hurt him every time. You trade information. You give as much back from yourself that's not harmful as you take in. If you want to have a proper conversation about how somebody feels, you tell them how you feel. Oh, I'm worried about you. Why? Oh, your results weren't good and I'm wondering if you can feel it. Oh, you haven't got blurry eyes, have you? You're not driving around in those kids with the blurry eyes. No, they are a bit blurry. Oh, well, we could, trade stuff. Don't take it all away. And if you come across somebody, we come across people living like this. They've lived there for 30 years. They're so proud they own that little house. And so you've got to work with what you've got. They say, this was a term, they said, some medical people just rob everything from us. Big suit, come in. We've got a mental health service that comes on a Friday to one of the areas right over there. Comes in his suit and he says, come in, we'll have a talk. They're cringing already. Comes into the office. They're robbing you of information and who they are, and they've robbed you of themselves. It's not an equal partnership. Everybody talks about the patient being the centre. Then go to the house, because guess what? You walk in a house, they'll tell you anything because they're in their domain. They're controlling the whole situation. You're the uncomfortable one sitting on their lounge. You're the uncomfortable one there with the family glaring at you, and then ask you questions. The power distribution has changed dramatically. And another one that was told to me is, oh, you lot come in and you've got the uniforms and you've got all that equipment, you're really loud. It's like you take over the mission. It's like, ooh, you're loud. We're loud. We're disturbing by our presence. There's even the way we dress. So what can be done? Education, not income, is the strongest and most consistent predictor of good health. Education, not income, education. We start with a new generation. We manage what we've got, but education. Prevention. We need everybody from when they're 5 years old, 4 years old, in an armoury of strategies on how to cope. I've got a daughter with anxiety. She said, Mum, if I'd have only known it was going to be like this, I'd have done all these courses and things beforehand. Nobody told me. I thought I was going to feel really good when I left school and everything, not an anxious mess. And I guess going through it and listening to patients, if she had an armoury of strategies and knowledge to know, why aren't we teaching it? If it's one of the most biggest killers in this country and affects so many people, why aren't we starting in school to say all the things, to give them strategies to deal with drug-addled parents or their mother who's going to get diabetes, doesn't have it yet, but they've already learnt strategies on how to cope with a sick parent. strategies, an armoury to prevent them crashing when it happens that deaths. I watched 5 deaths in 6 days 2 weeks ago in one of the communities I was at. None of them were over 50. What you have left after a death is a compromise of a person, a compromise of a child. It's a compromise for a long, long time because they don't know how to deal with it. They've never been prepared. So prevention, you want your Uber taxi? Prevent it. Be prepared for how you're going to feel. Know that you're going to be angry. Know that you're going to be this, and that's okay because it's normal. Know where you're going to get help. Not expecting these kids to deal with deaths of parents and grandparents, which will happen within the first 20 years of their life, and expect them that, oh, we'll get interventions out there once it happens. It's wrong. Don't ignore emotional and mental health. Always acknowledge and do something no matter what we're telling our people, but start with the young. That's just some of the houses I visit. That's 2 inches of shit with people living in it. Know your bias. See the world through ordinary eyes, not our eyes, not what it should be. And if somebody doesn't want a damn treatment, they don't have to have it. But that doesn't abdicate you from caring in any way you can. If they are choosing to continue on the path they're on, you can still make them feel better. Clear up a chest infection, clear up this. Remember, it's their choice. Our mob are 2 people, like I said. One's living in the past, clinging to it, whatever we can. One's living in the now. None are living in the future. Not many. Not those on the mission. I don't find kids who have ever been to Sydney or outside of some of the areas they go. And this is one area I'm talking about that's 70% white. Never look presidential or tyrannical. I had one girl came out with me the other week and she had this great little natty shirt with a collar turned up and tucked into its expensive pants. You look tyrannical. You look like you're rich and you're above them and you look like you're different. Don't try and look like you're going to lord power over anyone. Just remember, don't look presidential or tyrannical. Don't rob people with a stare. Some people say, oh, those nurses up the hospital, especially that sister. Some of them are old up there, still want to be called sister. That sister such and such, she just gives you the stare, mate, you're gone. They rob you with a stare. Consider all words said and do no harm with your words. The way you dress and talk and act can make a person feel stupid, cheap and small. Understand speaking with volume in a lot of these poorer communities is not ferocity. It just means that they don't have the words or they're frustrated and can't be heard. Volume, I hear people going, I'm never going back, and then they were shouting. They don't have the words and they're frustrated. They just want to be heard, and volume is the only thing that they have to make you hear the words that they have. Patients forget all the words we say and only remember the words that your words made them feel. They only remember how you made them feel with the words, not exactly what you've said, but just how you made them feel. And often the biggest thing I got back was they go, oh, I'm anticipating that they're just going to yell or they're afraid or anything like that. We speak in a way that implies that we can turn anything into gold. Do this, take this drug, do this, keep your blood pressure down, and we turn it all into gold. And guess what? It doesn't end up like that. This is just some cultural stuff, and I think it's really important. You can get it from the New Zealand cultural, and it sort of sums up a lot of what the patients were telling me. Unsafe cultural practice is any action which diminishes, demeans or disempowers the cultural identity. Culture could be, I'm proud that I was born in this household place. I've finished high school and I'm going to uni and I'm proud to come from here. You've got no right to take that away from them that they came from there. You've got nothing. And remember the balance of power. We carry it. We shouldn't. And don't do that. That's all they hear. Quite often that's what we hear. Oh, your HbA1c is really good and your full blood count, the white cell count was this, and they're gone. Norwegian scabies, I see it a lot. They're so afraid to come in, they wait till it's so bad before they bring it in because they don't trust us. They just don't trust us. Always, always remember the patient has the choice. Always. Just because you want them to be better doesn't mean that's the greatest quality of life. Work with what you can. Work with them, their family and their community, kin and community. And if you need to be, don't be hierarchical in your care delivery at all. You're just one person, they're going to meet a lot of us, but be the one person that they want to come back. Remember our power as nurses, and this is a good thing. We have the power. With all my heart, I believe we're the ones who cure, not somebody who comes in on a 6-minute consultation, hands out a piece of paper with a script. They often come in and say, is this good for me, Les? Have a read. I'm not going to go and get it until you read it. What will I have to do? How will I feel if they give it to me? We're the most powerful healers in this country. Please remember it. And Medicare needs to respect that. The doctors get richer and you're doing all the work. You're doing every scrap of work out there, and none of you are driving around in your BMW with your second beach house out there. And yet who did the work in that office? Who explained it? Who ran after them? Who stayed back? Skill up us who don't have mental health. I don't do heads and I don't do hoo-has. I'm a nurse practitioner, I can't do everything. And so skill me up. I want to do better in what I do. And I don't do heads. Develop a true model for rural settings. Get out of your city and centric comfort zones. If you're mental health workers, please get 6 of you and go up for 2 weeks at a time or 1 month out of every 6. Come up. Please get out of your comfort zone and come up and be where a lot of this people need you. Home visit. It addresses the context of setting and the power shifts to the person. It is truly a patient-centered model if you are in their home. All in-stage settings everywhere should have a psychologist, but I believe more so a mental health nurse, because you will have the time. You'll get to know them better. Every end-stage disease area should have a mental health nurse attached permanently to them. Start in the schools, teach them about anxiety, stress, especially those living in those environments. How on earth do you know somebody's got more distress or depression when they've been growing up in a stressful relationship with 2 parents on drugs to start with? How do you ever know that you've created more distress telling them they've got diabetes? Teach them to cope with parents and siblings with a chronic disease, engage better with your clients, don't hold the power, new models, change our next generation, start now with our next generations. And I can't change the World Health Organization that encourages a holistic concept of health. That is perfect. That's our conclusion. Always laugh with our patients, and we need, as the research showed on Medicare, we need a universal and equitable delivery of mental health care for all Australians, because that's the big hole in the country. Thank you.
Wow. We're a little bit over time, but we have time for just maybe a couple of quick questions, and then I'll let you mob Lesley out in the around the cup of tea area.
They need a cup.
Yep.
Just thank you. I'm Angela Roney. I'm from rural Victoria, and I'm a registered nurse, a diabetes educator, but I now work with a primary care partnership, which is state funded. We have a really lovely network of agencies and work with a really wonderful organisation called Mallee District Aboriginal Service, and they've got a lovely program, an early years strategy and bumps, babes and beyond, and it's basically working to quote Danielle, who manages it, wrapping around the family. And it just about brought me to tears when Danielle presented this beautiful program just on Wednesday last week to our local government and hospital, community health representatives. So there are some good things happening out in rural Victoria.
I feel sorry for the white mob.
Yep.
70% white guys that are out there living right next door to our Aboriginal mob don't get Close the Gap. They don't get food vouchers. They don't get anything that I can give to the 30% Aboriginal people who live there. I feel so sorry for that white mob that are living there in exactly the same circumstances with the same poor health and everything.
Absolutely. No, thank you. Wonderful presentation, and we should all get out there and have a look and be part of it.
I'd get you to put your hands together again, please, for our three very inspirational speakers. Thank you.